Hi, I'm Dr. John Smith. I'm the Dean of Instruction for the Sober College School of Addiction Studies. I wanted to talk to you a little bit today about co-occurring disorders. Sometimes we talk about co-occurring disorders. The old term is dual diagnosis. That means someone who has both a substance use disorder and a mental illness. So a co-occurring disorder is something that about half of the people that we deal with, either in the mental health field or on the addiction side, half of those people have some sort of underlying or co-occurring mental illness, such as depression, anxiety, or even more severe mental illnesses like bipolar disorder and schizophrenia. What we do and why it's important as an addiction counselor to be aware of these things is that you don't have to necessarily treat all of that. That requires a multidisciplinary team of professionals, psychologists, social workers, psychiatrists, and others, including addictions counselors, to work with all of these various complex issues and problems. But as an addiction counselor, it's really important that you understand and can identify as part of the assessment process people who might be experiencing other issues that could confound or complicate their sobriety and their recovery. I'm a person who's been working in this field for about 30 plus years and worked both in the mental health area and the substance abuse area. One of the things I learned early on in my career is that a lot of people I was working with in the mental health area had issues with addiction. Also, as I worked in the addiction field, I saw that many of my clients had other issues that affected them emotionally or psychologically, and that if we didn't address these problems simultaneously in an integrated way, then we weren't really effectively treating that person, and then they would go out and often treatment would be unsuccessful on both sides. They would relapse either because they had untreated mental health symptoms, or they would relapse because their addiction issues weren't effectively addressed. So I'm a big proponent. In fact, I am sort of a subject matter expert on this. I wrote a book called Co-occurring Substance Use and Mental Disorders, a practitioner's guide that's used by many colleges and universities to train addiction counselors and therapists about co-occurring disorders. So it's something that I'm very passionate about. It's something that I think is very important. And as addiction counselor, if I could say one thing that would significantly make a difference, is that every symptom of a mental illness can be caused by either drug intoxication or withdrawal. That means when we're dealing with people who have substance abuse issues who may also be manifesting other sorts of psychiatric or emotional problems, they may or may not actually have a dual diagnosis that may be the side effects of either being intoxicated by drugs or as part of the withdrawal process. So it's important to be able to recognize and understand that many clients that we will be treating as addiction counselors will have both types of issues, and that those issues must be identified and addressed and treated properly by a team of professionals in order to give the best and most effective treatment.